Stay tuned for a special edition of Healthy Connections. So let's say they get referred to you, Dr. Baker. You're a gastroenterologist. So first of all, just define for us what that specialty is.
It's the study of the digestive system. So from the time you ingest your food product until your body rids itself of it, it's called digestion, the ability to take nutrients from what you eat.
So in your practice, you deal with people who perhaps contract colorectal cancer.
Absolutely.
If you look at the numbers, is there a disproportionate number of black men who have colorectal cancer as compared to the white men or the general population?
Yes. Black men are overrepresented when it comes to colorectal cancer. We're the #1 group when we look at the incidence of colorectal cancer.
Why is that?
It probably has a lot to do with genetic factors. It has to do with diet. It has to do with sedentary lifestyle. And certainly smoking, which we tend to see in maybe in higher proportion in our population. Alcohol consumption is a risk factor. But age, diet, and sedentary lifestyle and obesity are the major risk factors for colon cancer.
So what is the best screening methodology?
The gold standard is colonoscopy. It's basically taking a long, flexible tube with a camera and a light and use that to examine all 6 feet of the large intestine. There's no doubt.
Now that does not sound like a day at the park for anybody.
Well, actually, you know, and that's one of the myths of colonoscopy,
okay,
that
let's
it's
talk
painful.
about that.
Well, it's not. It's done with sedation.
So you're knocked out.
You're knocked out.
Okay.
It takes 15 minutes to do the procedure, and it has been shown because of these screening procedures, the incidence of colon cancer deaths in America is declining. We can expect 140,000 people to be diagnosed with colorectal cancer in this country this year. It's the second leading cause of death from cancer in both men and women.
Is that because people wait until it's too late?
Right, and that's another myth. Another myth is that if I feel good, I cannot possibly have cancer, and that's not true.
Dr. Baker?
Yeah, you have to take charge of your health, and one way of doing that is being knowledgeable about screening procedures when they're required. In African Americans, a screening colonoscopy is recommended for everyone 45 and older. It is not based on symptoms. As I said before, you probably will not have any symptoms. But if the greatest chance or your greatest benefit or your ability to decrease your chance of getting colon cancer is to have a screening colonoscopy.
Because by the time you have the symptoms, the blood in the stool, it's progressed to a point where you get concerned. And
that gets into staging. That's exactly right. Diagnosed early, your survival rate at 5 years is 95% or more. Diagnosed late, when you see blood in the stool, or if you have abdominal pain or a bowel obstruction, your survival rate is 10% or less for 5 years.
I don't think anything else needs to be said after that. And once you have a colonoscopy, there's a long period of time before you need another one. Is that correct? That's right.
It's recommended every 10 years, unless you have a family history. There are some risk factors. If you have a family member, a close family member that had colon cancer, you should get a colonoscopy every 5 years.
But still, that's a small price to pay to be around for the people who love you and need you.
That's right.
So get your egos out of the way and get into see Mr. Williams or Dr. Baker. Gentlemen, thank you.
Thank you.
Thank you so much.
We're not done. Stay with us.